Good evening, viewers. Welcome to Health Vibes. My name is Musumola and I am your host. A very big thank you to my viewers, my friends, my family out there. I just want to say thank you. Thank you, thank you, thank you. Thank you for the referrals. Thank you for sharing my videos. Thank you for trusting me enough to speak with me. Many people are calling me from all over. I really do appreciate this. And I also thank you for helping those people that are depressed. We need to help ourselves. On last episode, we got talking about depression. Dr. Akinola spoke to us about so many things. The difference between depression and psychosis. So many things about depression. And today we have more things to talk about. I'm excited. My eyes are open. I just want to go on the street. It's like I should go on the street and start talking to all the people that are depressed because there is hope.
Yes.
So ladies and gentlemen, join me as I welcome Dr. Akinola.
Good day, everybody. It's good to be here once again, and I hope we're going to have a good time again.
Oh yes, yeah. I had a lovely time the last episode.
Thank you for having me.
Thank you very much, Dr. Akinola.
It's a pleasure.
You see, I discovered something. Since I started my study on menopause, it's like depression is so endemic. How can we help ourselves?
Well, I want to say,
especially amongst women, how can we help ourselves?
I want to say a big thank you to you for what you're doing, because it is amazing.
Thank you, Dr. Akinola.
Putting information there. We say information is power.
Thank you very much.
So kudos to you. So
thank you,
people
Dr.
need
Akinola.
to know, and I think the most important thing is we all must learn not to keep things to ourselves. And people should stop running away from the doctor. They'll say, if I go to the doctor, the money is it's going to be so expensive. And I tell people that's not true. For example, I work at the psychiatric hospital, and I tell them, come over there, say, they said it's expensive. Somebody said. We should, all of us should stop listening to what people say. Go there and find out for yourself. So come in, let's do the assessment. It depends on what is found. It could be outpatient, you come for clinic regularly, it could be admission, but nobody knows. You have to go for assessment first.
You see, Dr. Akinola,
yes,
that
please.
Thought of Yaba lift.
Okay, so
it's scary.
So I tell my clients, what is the most important thing to you and I? That I am healthy mentally. I can think, I can plan, and I can accomplish my purpose. So if I have to go to Yaba left, then I'll go. But on the other hand, it's not only Yaba left that we have. So we have psychiatric units where you meet psychiatrists, psychologists, social worker, counselors in practically all the federal teaching hospitals now, federal medical centers. I mean, that is a policy that the government has made. So you can walk into any federal medical center, most of them, they have psychiatric units, general hospitals, teaching hospitals. So people don't know where you're going if you go in there. But right now at psychiatric hospital Yaba, where I work, we have so many things. We have we have a gym, you have table tennis, is it club or center. So if you go into psychiatric hospital, that doesn't mean you're going to see a psychiatrist. You could be going in there for so many things. That was why we opened up the hospital. But I think the most important thing is for us to be healthy. Yeah. Let's remove the stigma surrounding psychiatric illnesses. Because as simple as it sounds, you said it, depression, not only in Nigeria, it's all over the world. It's like the third leading cause of morbidity all over the world. Why? What's morbidity? It won't allow you to do what you're supposed to do. Because you can't think well, you can't remember things, you can't even assimilate when they're telling you something. So if you go to work, they give you an assignment, you do not meet the deadline. If it is a student, the student cannot cope in school. So just sit in the room, be crying, and will not go for classes. because they can't assimilate, because their mood is down. So it affects, and you know, they'll say, but you're normal. The person will be looking normal, but the person is not well mentally in the mind. And all of us must remember there's no health without mental health.
Thank you.
So if your mind is not okay, you can't
do anything.
Absolutely, you cannot do anything.
Thank you
It is
very
important
much.
that we go to the doctor.
Thank you very much, Dr. Akinola. My next question is this: can we prevent depression in menopause?
Well, you know, usually you don't really know who is going to come down with depression during this menopausal season, because like we all know so many things. Genetic composition, so we talk about the nurture and the environment, your makeup and the environment where you live. So I think the most important thing is for people to know that it can happen.
Yeah.
So when you start feeling odd, you know, your mood, I don't want to do those things that used to give me pleasure, I don't want to do anymore. You're feeling sad, you can't sleep, you don't have an appetite, and it's going on and on. It's not affecting your function. Please don't keep it to yourself. Seek for help.
Okay.
Go to the doctor. And so if you go to a GP, it will refer you appropriately. Okay, I think you need to see a mental health practitioner. And
Okay.
Yes.
Some days ago, Dr. Akinola, a young lady of 51-year-old gave me a call.
A young lady.
Yeah.
At 51. That's good.
Life
As 50.
Yeah.
That's the new normal.
Nobody should call me mommy. Oh, I'm a young girl.
Yeah.
She gave me a call, and then she went on and on and on. She has not made love to her husband in like 2 years.
Yeah.
She stopped going to work for the past 6 months. She's very irritable.
Yeah.
Her husband cannot talk to her, and her husband cannot come close to her. And when she called me, she actually told me that day was her husband's birthday, and she's not celebrated her husband in the past 2 years. And while I was talking with her, she's busted out crying. How can we, or could I have helped her?
I just referred her.
I agree with you, I should have referred her. But you see, number one, I'm not sure whether she would probably go to Yaba left.
It doesn't have
Number two,
Okay.
there must probably be a primary help or initial help that people around will give to such people.
Okay, maybe for people like you.
I don't think everything should be, everybody at the initial stage should run to Yaba left.
Well, you see, no, don't say that, because we do know that there are different stages to depression. So you have the mild, the moderate, and the severe.
How do I know when to go to Yaba left?
Because you have tried the little small things that I'm going to talk about now.
Okay.
Okay, so it's like she spoke to you. Since you have a better understanding what depression is all about,
Yeah.
you should have just invited her to come in, and you know, you actually talk. So what are the things that are on her mind? So you see where you can change her thinking, because you do know that the problem with depression is the thought pattern. Okay, so one little thing happens to you. Let's give an example. You fail an exam, then you say, I am a failure. Because you failed an exam does not mean you're a failure, because all the other areas of your life, they are still working. It's just that point. So it could be maybe you didn't study hard enough, or anything could have happened at that point in time that you failed that paper. Okay, so that's, you know, we call it generalization, little things, faulty thinking. That is the basis of depression. So if you had seen her, maybe counsel her, then what is going on, maybe call her husband in, this is what your wife is going through, so can you support her? So depending on the problem, the actual problem, because why is she not sleeping with her husband, what triggered it? So if you can manipulate that, we call that environmental manipulation. You can do talking to her, call social support for her, so people will help. You know, like I had a patient that I said, look, because there was a strong genetic underload, so I didn't want to start her on antidepressant again. So I said, okay, so what are we going to do? So she said she had a friend with her, and that's social support. So the friend was with her. The friend would follow her to make sure she goes to work, At least the little she could do, they would go out, so that, because all she wanted to do was stay in her room and close her curtains, and everywhere was dark. Do you understand? So if you do all that, then you learn to sleep. If you're not sleeping well, we could give you something to make you sleep. Begin to eat proper balanced diet. Try and exercise. Say whatever is bothering you out. Don't pile everything. So if you do all these, it seems little things, but they are quite important. You do them and you see that the person is not improving. Okay, then you might. So maybe some other things are coming. You might need to now use the talking therapy. That's the counseling and medication. So you need to see the doctor.
Thank you very much, Dr. Akinola. Another question for you. You have been talking about it bit by bit.
Yes.
How do I know as a person that I'm going through depression? Let me use myself as an example. Some years ago, I went through an issue and I didn't know I was going through depression until when my 9-year-old boy spoke to me and said, "Mom, you need help." And the next thing that came to my mind was, sincerely, I don't think I've ever heard that word, depression. And from nowhere, I just heard that word. And I brought out my laptop. Out of 15 signs and symptoms, I was going through 13. And I know that as a professional, the first thing that should come to my mind is to go to Yaba Lift.
Not necessarily.
Well, you have said it here. But you see, I lived with that for a long time. And you see, if my son had not mentioned, "Mom, you need help," I wouldn't have thought I was going through depression. As a woman going through menopause, what are the things that you think I should look out for? Not even only menopausal women or men. Generally, what are the signs of depression?
So the signs and symptoms of depression. Like I said, the 3 cardinal, important ones are, not feeling happy. They wake up in the morning, they're just feeling sad, unhappy, and sometimes it will get worse as the day go by. And you sleep for 8 hours and you wake up in the morning and say, "I'm tired." So people will wonder, but you just woke up, you slept for so long, why are you tired? So they didn't do anything. So there's loss of energy, then loss of interest in things that they used to love to do. You call me, "Come over to my house," and I said, "No, Musu, I don't want to come." And you're like, "That is strange. For me, what's going on with you?" Do you understand? So things they used to love to do, now they don't want to. There's no energy to do anything. And so poor sleep, they start sleeping poorly at night. And particularly, they'll tell you that usually they wake up at 2 a.m. and they can't sleep, and you wonder, "So what were you doing?" I say, "I was just lying down there and I was thinking and thinking about what?" So we call it rumination. So they begin to go back and think of all kinds of things, and that can waste time. Sometimes they'll sit there for hours and they don't even know time has gone because they are thinking and thinking. Okay, so there'll be loss of concentration, loss of attention. They can't remember things, and then of course if they're not eating, poor appetite, people will start losing weight. I've had patients that I had to ask, "Are you a sickler or there's something chronic illness?" It can be that bad. That people will stop eating, And so what are the symptoms? So we've talked about not eating, not sleeping well, poor attention, poor concentration, and as that goes by and they don't get well.
That's what actually I think leads to women not being able to make love to their husbands.
Yes, because they lose interest.
They lose interest in everything. Wow.
So their mind is not there. They're telling you, "I'm feeling this," they're telling me what to. What has that got to do with how I am feeling? And they're just not there. Okay, so and as this progresses and there's no help, they'll begin to feel helpless because things will begin to feel overwhelming, as if they can't find solution to whatever they think is going on within them. So they feel helpless and they start thinking, "Is life worth living? Life is worthless. Their life is worthless." And so it's a gradual thing. Then one day the thought will just come in. So why don't you just kill yourself? If you think So that's the progression usually that depression goes. So, and we must remember that one cardinal point of emotional illness is a change in behavior. Somebody that has been active, or you go to, it's like you come to my house, you know that my house is always everything in the right places, children well dressed and all that, and you come and see that there's dust everywhere, and the children are just running up and down. So you're wondering, and for me, what's wrong with you? I say, what's wrong? There's nothing wrong with me, but you can see from my house that there's something wrong.
Wow.
So because I do not have energy to do anything, I'm not even interested if the house should go to blazes. I don't care.
Wow.
Do you understand? I can't even comprehend that.
That's a form of depression.
Dirty. Yeah. Because I can't even comprehend that my house is dirty.
I'm actually thinking.
Don't go there.
Oh, before we round up for me, something came to my mind just now. I remember when I was going through those depressive spells.
Yeah.
That there was, at the initial stage, I noticed that I would just talk. I could even go to my security guard, just sit down with my security, as long as you want to listen. I would just talk. Don't you think, is that a form of depression?
Well, we do know that there are all these symptoms that I've talked about so far are the typical ones, the usual ones. So we could also have atypical depression. They say high functioning depression. Some people are depressed and they still go to work. They go to work, but if you look at them really, you see that their level of functioning has reduced.
Wow.
Then you see their interaction with others. So we talk about people sleeping too much, people eating too much. These are atypical presentation of depression, and you can see people that are irritable. Wow. But the typical thing is that the depressive patient won't have energy to even talk at all. They can't even put their thoughts together. That to the extent that they'll start talking. So we could say, but we must remember that depression can be complicated with psychosis.
Yes, we made mention of that at the last episode. Yes. Thank you very, very much for it. Wow, you've heard it all. Are you out there? Now you know the signs and symptoms of depression. You've lost interest in so many things. Or instead of your normal, healthy habits, you don't have interest in eating, or you just eat abnormally. You have difficulty in sleeping, or you're withdrawn. It's time for you to seek for help. Please don't keep quiet to yourself. Remember what Dr. Akinola said. Depression can actually aggravate to psychosis. And you know what she said about psychosis? You lose touch completely. Don't let us, yes, it's a reality. Don't let us wait till we get to that stage. Please seek help. And she has told us again that there's always help.
Yeah, very easy to make a diagnosis and treat.
Please, let us
Not
keep
expensive.
talking. Or if you have a friend that's going through this, please look out for your friend. Please, let's help ourselves. Well, thank you very much for listening. And thank you very much, Dr. Akinola.
A pleasure. Anytime.
I hope to see you on next episode. Until then, stay healthy, keep smiling, and stay tuned.